Yeah.
Deal with it. Okay. All right, ready? So, rapid fire questions. Jillian and Hannah, thank you so much. Appreciate you guys doing this.
Thanks for having us.
Okay,
Yeah,
so
thank you.
let's do this. I'm going to throw some questions out at you and just kind of want to hear your take on it. So, question number one is, what's the most frustrating thing you hear from new patients that was told to them before coming to see you?
Yeah, I think the number one frustrating thing is either providers don't know next steps. Okay, you were diagnosed with lymphedema. What else can there be done?
Right.
And the number two thing is the patients spend all this money on compression garments that don't fit properly. So it's a waste of their time and their money, and they continue to be frustrated.
So, when should they be fitted for compression garments? Or is it just that they're not being fitted right?
Both.
Okay.
So there's a couple different types of compression garments. There are decongesting garments, so that help the patients decrease the lymphatic load in that limb, get rid of the swelling.
Right.
And then once they hit the plateau of there's no more swelling or there's minimal swelling, then they can go into a maintenance garment.
Gotcha.
So the number one error I see is that they are fitted for maintenance garments when they still have fluid to lose. And so of course it's going to be uncomfortable and hard to get on because you didn't go through the treatment process.
And if it's too tight, does it like create a reverse effect?
It can.
Yeah.
It can create a tourniquet, and that can lead to more swelling.
Wow.
Well, I think patients think the tighter the garment, the better, but that's not true.
Gotcha.
Because it really should be a gradient where it's tighter at the further part of the arm and then a little bit looser up top.
Gotcha.
So,
Okay.
yeah, doesn't always equate.
Cool. What's the biggest lie people believe about lymphedema recovery?
That's a tough question. I think there's a lot of myths out there.
Okay.
So I don't think there's lies per se. I just think there's misconceptions. So lymphedema is typically a lifelong diagnosis, but we can come up with strategies that we can decrease the swelling, minimize the pain, and help create home management strategies so that way they can manage it well for the rest of their life. It's not going to lead to skin breakdown or hospitalizations and infections.
Gotcha. Okay. Do you think that they're myths because people are just uneducated, or has like the game just changed so much with it over the years?
I think it's the lack of education.
Lack of education.
Yeah.
Okay.
So you take physicians, they go to med school for 4 years. On average, physicians only get a 45-minute lecture on the lymphatic system. When we were in our doctor to physical therapy program, we got a 3-hour lecture and a 1-hour lab on lymphedema. But even with that information, that didn't set me up for success of how to become a lymphedema therapist.
Okay.
So just even in the medical community, there's not enough information. So then you take the non-medical community, how are they supposed to know how to navigate that diagnosis?
Yeah.
100%.
And there's not enough resources for patients, right? There's not enough, lymphedema therapists or people that even can properly diagnose lymphedema.
Right.
So I'm sure that's it is a frustration for patients that are, really looking for care and just can't get the care that they need.
And just people aren't well versed in it. We were just talking about that before. Okay. What's a small change that your patients swear by, but outsiders think is pointless?
I would say that the compression garments are really the key to their long-term maintenance of their disease. It's not just wear it when you feel like wearing it, wear it when your arm is swollen. Right. You should be wearing it throughout the day to prevent your arm or your leg from getting swollen. So it's not just a 10-minute, just wear it when I feel like it. It really needs to become part of your routine.
Gotcha.
I equate swelling and lymphedema to, I compare that to people that have vision issues, right? If you have a vision issue, you wear glasses every day so that you can see. If you have a hearing impairment, you're going to wear your hearing aids so that you can hear. People with swelling issues, you have to wear your compression garment so that way you can stay mobile.
Right. Wow, that's a great analogy. Okay. If your provider isn't talking to you about this, you're in the wrong place. What is this?
I would reframe that question a little bit. I would say if your provider isn't willing to read literature or research on their own about lymphedema and then support you in your journey, then you need to find a new provider.
That is huge.
I think the other thing is that if a provider gives you one piece of the puzzle of your solution, they need to be giving you the full piece, the full, slice of the pie or whatever. So it's going to be there's multiple domains in their care.
Right.
It's not just getting them a garment, right? There's a lot of different components that go into lymphatic health and a lymphatic plan of care. So it's not going to be just a quick fix.
Right.
So we need to, they need to be directing patients to somebody that really knows the intricacies of a lymphedema plan of care.
Well, just the first question that we had today of there's the maintenance level, garment, and then kind of like your initial garment, right? And I don't remember seeing that.
Yeah, things have definitely progressed over the last decade to decade, and even you check back 5 years ago, the options out there.
Right.
And then I love talking about patient advocacy. You have Kathy Bates, who had breast cancer, so she's an advocate for arm swelling, lymphedema from breast cancer.
Right.
And then you take Wendy Williams, she has lower extremity swelling. So you have two amazing women who have a platform and they choose to use it to help advocate for people just like them.
Right, yeah. So we kind of talked about an outdated piece of advice, and that's one thing. Are there any other outdated piece of advice that you're having to fight? Maybe it's kind of a little cringe when you hear it.
Yeah, so I would say with any sort of medical advice, you need to make, as a patient, you need to advocate for yourself and you need to make an educated decision, right? So you're going to have medical providers, whether they're physicians or physical therapists or whomever, and they're going to give you the facts. You need to take those facts and figure out what works best for you and your body at that time. 30 years ago, it was told for lymphedema patients, specifically after breast cancer, arm lymphedema patients, that you can't take a blood pressure in the involved arm, you can't have IVs in the involved arm, and that was written in nursing texting and textbooks. Now, those textbooks are the same today as they were 30 years ago, and that is actually a myth that has been debunked. Now, here's the education here, the educated decision is, okay, you have two arms. Most people have two arms, right? So why not use the non-involved arm for a blood pressure and an IV? However, if there's a reason that you can't use the uninvolved arm, you're not going to develop lymphedema immediately. You're not going to develop an infection immediately if you have to use that arm. So that, I think, they didn't know 30 years ago.
Right.
Unfortunately, they haven't updated some of the textbooks out there in medical practice. And so that is still something that is being told to patients.
Yeah. And I think too, just not to use the arm. This arm now has issues, you really shouldn't be using it.
Right.
Well, we know that the lymphatic system works better when the muscles are able to pump and push that fluid where it needs to go.
Right.
So that doesn't happen when you're immobilizing the limb.
Right. Wow. That's awesome. What are values and beliefs when it comes to lymphedema care? I'm talking your values, your beliefs.
So what I stand on, my pillars are treatment, education, and advocacy.
Okay.
As a physical therapist, obviously I'm going to be performing treatment. I'm always going to be providing excellent care. I think education is something that some people miss out on. So they do all this treatment, but maybe they don't have the time or the wherewithal to educate their patients on why they're doing this and why they need to keep up long-term maintenance strategies, right? They don't talk about the risk for developing infections, the risk of skin breakdown or weeping. And so that is, something I really am strongly for.
Okay.
And then advocacy. If it's not me, then who, right? I need to step up because I have the knowledge, and maybe I don't have a platform like Wendy Williams or Kathy Bates, but I have some form of a platform.
Right.
And we live in the age of technology and community, so I might as well use the gifts and the knowledge I have and be and advocate for patients and people out there that have this diagnosis.
You said treatment, education, and advocacy, but you said that education was the one that we're not doing enough of.
Correct.
So my follow-up question with this is, why are therapists not doing this? Is it because they don't want to empower patients? or what's your take? I just want to hear from both of you and your take with that.
Well, I think it takes a lot of time. I think that it takes an emotional toll sometimes on a therapist to really get patients to understand that this is a lifelong condition that they're going to be managing, and to be able to empower them to be independent in their care after their therapy plan of care, after that intensive phase.
So it's more of a time thing, you believe?
Absolutely.
Not necessarily they don't want to empower the people.
Oh,
they just
no.
don't have the time to do it.
They don't have the time,
I
right?
think therapists have the best interest of the patient, but execution sometimes there are barriers to executing that.
Yeah, so gold standard for complete decongestive therapy is the patient will come in and receive manual lymphatic drainage, do the bandaging, go through exercise, and be taught all of these skills. And gold standard is 5 days a week. Well, in our healthcare systems, we don't have that capabilities because providers have 12-week wait lists. They don't have the capacity to see patients 5 times a week. And some people don't have extended periods of time. Some people only get 30 to 45 minutes to do this. And it can take 30 minutes just to bandage somebody.
Right.
So yeah, it's a time issue.
Right.